Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome to a different video today. Today I want to share with you an imperfect case. Now I'm going to call this unavoidable bleeding, and with any medical procedure there are risks, and when it comes to microsuction, bleeding is one of them. And what you see here is very deep in the ear canal there's this plug of dead skin and wax and hair, and this has been pushed right down due to the patient using one of those little ear douches. So she's applied hydrogen peroxide drops and then used a bulb and she shoved it in and then squirted water into the ear quite vigorously. And right around here, as I'm starting to pull on this plug, watch what happens. So pull right around here and bang. So that quick exit out of the ear canal was because the patient yelped in pain. Now, after investigating, I said, are you okay? Are you feeling sick? Are you feeling dizzy? No, she was fine. It was just a momentary spike of discomfort. And looking back in, there's no blood anywhere. So I thought, right, well, there's probably some damage lurking behind the plug. So I continue. And upon pulling the plug further out, there's no further discomfort. So, the damage has been done, basically. And what's actually happened here is that basically I've ripped away a little bit of the epidermis. And whenever you see blood coming from skin, you've breached the dermis. So your skin has, so I'll mark the areas of bleeding with arrows. There's just two little spots of bleeding. But your skin has three layers, so epidermis on the top, and then the dermis, which is where all the important stuff is, like blood vessels and hair follicles and things and nerve fibers. And then the hypodermis underneath is just like fatty tissue, so subcutaneous fat. So those little spots there, as I've pulled on the plug has taken with it some healthy tissue. So it's taken away some epidermis and then exposed the dermis and of course ruptured some blood vessels. So, aside from those areas of bleeding, the ear doesn't look particularly pretty, but the eardrum is exposed and the hearing loss is resolved. And, despite the areas of trauma, the patient's actually feeling a lot better. So obviously now I don't want to go poking around in there. I'm just going to let the ear heal up. And I followed her up a couple of days later, and of course the ear's well on its way to healing. There's no infection, there's no swelling, there's no inflammation. So, best case scenario really. I'm just going to treat the other ear, and this ear procedure goes absolutely fine. There's no complications here. But I wanted to share this with you because, I like to share lots of weird cases on this channel, different cases, not just, perfect earwax removals. And most of the time, and I make this very clear to students that I'm teaching, if you see bleeding in the ear, the vast majority of the time it's due to the fact that you're being heavy-handed. However, in very rare cases, it's unavoidable. And looking at this case, I don't think there's anything I could have done differently. As I was kind of manipulating the plug and folding it over and getting ready to pull, there was no discomfort whatsoever. She was absolutely fine. So there were no sort of warning signs there that would happen. So, unavoidable, as I said. So there we go. I hope you found that interesting. If you have any questions or comments, leave them down in the comments section below and I will try my very best to get back to you. And of course, I will see you guys on the next video.